Hello guys, how are you? Today we are going to talk about the pathology. First of all, what is pathology? As we know, pathology, okay, it is a study of disease, specific study of the molecular, cellular, tissue, or organ system responsive to injurious agents. It also provides an understanding of disease processes encountered, their causes or etiology, pathogenesis, their morphological appearances, clinical effects or signs and symptoms, and prognosis. And also, pathologists are the diagnostician of the disease. That means knowledge and understanding of pathology is essential for all who would be doctors, general medical practitioners, and specialists, since unless they know the causes, mechanisms, nature, and the types of the disease, and understand the language spoken by the pathologists in the form of laboratory reports, they would not be able to institute appropriate treatment or suggest preventive measures to the patient. As generally, this means your practice of medicine will be as good as your understanding of pathology, as said by Sir William Osler. And the pathology is a study of the foundation for all of the medicines. That means pathology serves as a bridge or link between the preclinical science, that means anatomy, physiology, biochem, and the course in the clinical medicines. It is a bridge between the preclinical and the clinical medicines. Your practice of medicine will be as good as your understanding of pathology, as, as said by William Osler, clinical bridging subject foundation. It is a bridging subject of clinical and preclinical. It is showed by these pictures. Okay, traditionally the study of pathology is divided into two: general pathology and systemic pathology. When we say general pathology, it deals with the basic reaction of cells, tissues, or to abnormal stimuli that underlie all diseases. Such reactions are often not tissue specific. Example, cell injury and inflammation, neoplasia, or cancer, aging. That is studied under the general pathology. And also systemic pathology, specific responses of specialized organs and the tissues to more or less well-defined stimuli. Ischemic heart disease, that is the disease of cardiovascular systems, goiters, it is endocrine systems, and the pneumonia, it is the respiratory systems, and the breast cancers. And those diseases are studied under the systemic pathology. The course of pathology. As we know, pathology gives explanation of a disease by studying the four aspects of the disease. We should have to know these four aspects of the disease before specifying the disease. First, etiology. What is the cause of the disease? Pathogenesis. How it can cause the disease. Morphological changes. What is the structural changes can we see in the disease? And the fourth one is functional derangement or clinical manifestation. That is the sign and the symptoms that can we see from the patients. When we see one by one, etiology, the first of the aspect of the core of the pathology is etiology. Okay, etiology is the cause of the disease. High of the disease. What is the cause of this disease? If the cause of the disease is noun, it is called primary etiology. We should have to say primary etiology if the cause of the disease is noun. If the cause of the disease is unknown, It is called adiopathic. It is adiopathic. It is not noun. It is cause is not noun. Knowledge or discovery of the primary cause remains the backbone on which a diagnosis can be made, a disease understood, and a treatment developed. We should have to know. We should have to know those agents. And what is the cause? When we say what is the cause, we can classify acquired causes and the genetic factors that acquire this. It may be environmental. The causes that can triggered by environmentally can we see. The first one is physical, chemical, nutritional, infectious, and immunological, psychological. Those are the causes underlay under the environmental agents. The second one is genetic factors. Genetic factors is genetically transmitted agents, mutation, polymorphisms, and so on. Okay, when two or all these causes are underlay by one, it is known as multifactorial. For example, diabetes, atherosclerosis, hypertension, and the cancers are multifactorial. That means it can be caused both by environmental agents and the genetic factors. Okay, etiology. Etiology, when we say this, the cause of the disease, as we see from these three things, we can classify into three depending on the agents that can cause one disease and the several etiologic agents that can cause one disease, or single etiologic agents that can cause one disease, or single etiologic agents that can cause several diseases. As we see from the first one, the triangles replaces the etiologic agents. Okay, one etiologic agent can lead to or can cause one disease as malaria. As we know, malaria can cause by plasmodium. And the second one is several etiologic agents that can cause one disease, atherosclerosis, diabetes, and there is so many diseases that can cause by several agents. And the third one is one etiologic agents that can cause several diseases. As we know, smoking is the single agents or single etiologic agents that can cause several diseases. The second one is pathogenesis. What's pathogenesis? When we say it is a mechanism of disease development. How of a disease is formed? It refers to the sequence of cellular, biochemical, and molecular events in the response of cells or tissues to the etiologic agents, from the initial stimulus to the ultimate expression of the disease. It means the mechanism through which the cause operates to produce morphological changes in the clinical manifestation. The third one is morphological changes, structural alteration. When we say morphological changes, it is structural alteration induced in the cells, tissues, and the organs of the body, characteristic to the disease or diagnostic to the etiologic process. And also it's seen with naked eye or under the microscope. If it is seen under the microscope, it is microscopically, and we can see naked eyes. It can be a gross that we can see naked eye. This is what we call naked eye. This is microscopically that we see, and this is microscopically and also this is microscopically large cells or mitotic features. It is mitotically deranged cells. Both the gross and the microscopic morphologic changes may only be seen in that disease. That's what we call it is specific to that disease or pathognomonics. Therefore, such morphologic changes can be used by the pathologist to diagnose the disease. In addition, the morphologic changes will lead to functional alteration to the clinical signs and the symptoms of the disease. And the fourth one is functional derangement and the clinical manifestation. The end results of genetic, biochemical, and the structural changes in cells and the tissues are functional abnormalities which lead to the clinical manifestation. That's what we call signs and the symptoms of the disease. The morphologic changes influence the normal function that lead to determine the clinical features. Also, the course and the prognosis of the disease. The morphologic and the functional changes together with result of other investigation help to arrive at an answer to what is wrong, diagnosis, what is going to happen, prognosis, what can be done about it, treatment, and finally, what should be done to avoid complication and spread. That's what we call prevention. Okay, the other one is disease. What is a disease? Disease is defined as any alteration from the normal function or structure of an organ, and also it is expression of discomfort due to structural or functional abnormality. Actually, causes of disease. What are the causes of disease? It may be environmentally determined, genetically determined, or both environmentally and genetically determined. What are the types of disease? There are so many types of disease depending on their duration, congenital or acquired, degree of severity, or depending on their causes. The first one is inflammatory diseases or neoplastic or degenerative diseases. When we say inflammatory diseases, we should have to say inflammatory disease when the deceased person or the deceased patient is inflammation. When there is inflammation, we can say inflammatory diseases. And also we can say neoplastic when there is unprogrammed cell proliferation. And the acute and the chronic diseases. When we say acute diseases, it is short period of time, or it may be days to a weeks. And also we can say chronic diseases, it have a long duration. It may be months to years. It have a long duration of times. That means it may be long up to months to years. And also we can say congenital or acquired diseases. When we say congenital diseases, the disease that can born with it, and the acquired is the disease that can we acquire after birth. And depending on their degree of severity, we can classify into mild, moderate, and severe diseases. And depending on their causes, we can classify into genetic causes, genetically determined disease, and environmentally determined disease. And those causes are environmental agents. It may be physical, chemical, nutritional, infections, immunological, and psychological are environmental agents. And the other causes are genetic factors, maybe mutation, or it may be polymorphism. When both of them are on one it is what we call multifactorial. For example, diabetes disease, hypertension, and the cancers are multifactorial diseases that can cause the either environmental or genetically or both of them. This is malnourished patients, and this is obese man, and this is physically injured man, and this is electrical burners. As we know from these pictures, there is injuries on the hand, and the other one is course of disease. Exposure can lead to biological onset. This can lead to clinical onset. This can lead to also permanent damage. It is finally lead to this. Course of a disease without any intervention is called natural course of a disease. The course of disease is shown with a simplified diagram as follows. Incubation period, which can lead to exposure. After exposure, biological onset will be. It is lead to clinical onset, permanent damage, and finally to lead to this outcome of disease. The deceased patient is what will be. It may be resolution can occur leaving no sequelae. The second one is the deceased can settle down. The disease can settle down, but sequelae are left, or it may result in this. Actually, natural history of disease. First, exposure to the hosts. After hosts exposure, it may be deceased. The deceased hosts may be recovery completely or left disability and can lead to this. Okay, clinical disease and biological disease. What's the difference between clinical disease and biological disease? When we say clinical disease, it is the reversible transmission between life and biological disease, and it also defined as a period of respiratory, circulatory, brain arrest, during which initiation of resuscitation can lead to recovery. As generally, clinical disease reversible transmission between life and biological disease. Okay, the second one is biological disease. Biological disease is sure sign of this. It is a set is in after clinical disease is an irreversible state of cellular destruction. It is irreversible state of cellular destruction. It manifests with irreversible cessation of circulatory and respiratory function, or irreversible cessation of all function of the entire brain, including the brain stem. This is what we call biological disease. The difference between biological disease and the clinical disease. Biological disease is irreversible state, but clinical disease is reversible state. Okay, immediate postpartum changes in biological disease. Rigor mortis, contraction of muscle, stiff limbs, pallor mortis, paleness in the first 50 to 120 minutes, liver mortis, bluish discoloration on dependent part of the body, algor mortis, cooling of the body, autolysis degradation of the body. Thank you for watching this video. If you like this video, like and subscribe. Thank you.